Welcome back to HMA 2021 and a good afternoon to all of you. If you just joined us, my name is Noah. I'm the Content and Community Manager for HMA, and I'll be your host for today. I hope all of you had a good lunch and are raring to go for the afternoon sessions of the conference, where we'll be discussing topics like integrated general medicine, the hospital at home care model, which we heard about from Mr. Lim Cho Wee in the morning. We'll also talk about remote working for healthcare professionals, evolving safety standards, and much, much more. Of course, we'll also have the highly anticipated HMA Award ceremony later in the day, so do stay tuned for that. Now, before I introduce the next speaker, I'd like to remind everyone again to take part in our contest and try to win yourself some amazing prizes. You can find more information on how to participate in the contest tab, so do check it out when you have the time, but not now, because in our next session, we'll hear from Mr. Rene Holler, Senior Global Marketing Manager for Enterprise Services at Siemens Healthineers, who will be speaking about a very interesting subject, enhanced patient experience with digital twin simulation. Welcome, Rene.
To be here, and I would love to give you some insights now in the next few minutes. So, enhanced patient experience by digital twin simulations. What does that mean? Actually, when we look at a bit what is the experience of care basically for a patient or for all of us when we are in a situation where we need medical help. So there are some questions popping up. Who will care for me? How fast will I recover? What is the impact of my life? There's anxiety, fear, but of course also hope. And the idea to improve patient experience is, of course, to improve these mental state. That means giving answers to the patients. So this improves the mental preparedness as well, of course, as the perceived experience, which can be boosted in a positive way, and of course the health outcomes overall. So what is the possibility and what are the factors to influence this? Basically, there are three key factors to it in the healthcare system. One is, of course, the staff. That should have a positive enablement of the patient to prepare him the best possible for his upcoming procedure. And of course, there's technology. It should be patient-friendly. It should be not look scary. It should be looking advanced. It should be look nice and welcoming, and not that a machine or a robot is threatening to you. Again, anxiety and fear is something very counterproductive. And of course, there's an efficient process. Imagine you have pain and you have to wait long hours or long minutes, as at least perceived, until you get finally your treatment. This is also something that will negatively influence your experience for care. So how can you improve that? Of course, making the process efficient, lean, and fast. Then when you optimize these factors, of course, you have to look at some obstacles that you typically face. And this is also what we have in the customer discussions very often as a medtech provider. So you have to take into account the complexity of hospitals. So you cannot just redesign everything from scratch. You just have to use what's there and make the best out of it. And then you have some discipline-specific requirements. Of course, if you work in a cardiology department, it's highly different than from a pediatric department, for example, or from an oncology department. So how the audience is, the patient audience, and also the personnel, there needs to be specific adjustment be taken into account. And also you have a variety of stakeholders. So it's of course not just the nurses that work there. You have medical professionals, you have maybe a daytime clinic or a dedicated ICU, totally different environments. And also this is something you need to take in account when you would like to improve patient experience. And now, how is technology helping us to achieve the best ways possible? One is the thing that we usually use a digital twin, which is quite a nice technology from the industry. So we create a digital twin from real-world institutions. We then take this as a parametric model and test an impact of changes that we would like to anticipate together with the customer virtually. And then we try to implement the changes in the real world, which have been simulated. So instead having trial and error, you can simply try with a very good model to really get there where you want. And what is a bit needed for digital twin. So basically, you need to have good data. This is very important to analyze and assess it. And then you can have digital twin. For example, you want to improve the digital twin workflow, so you can model all the process times and mappings and dependencies. And then you go over and define and simulate the scenario. And lately, you get then the layout and infrastructure outcomes that you would like to have. So you can run different models versus others and then look at the parameters that they give and what's best to choose. And this ultimately then results in a very much improved space and design and time optimization. So for example, the safety and privacy can much better improved. We can create much nicer looking rooms so that people do not feel scared. Here in the middle, for example, you will see a mammography room. And on the very left is a waiting room for a patient that we also will see in a few seconds again. This is something done in the University Clinic of Erlangen. And also here is an MR example, how you can maybe make a room look nice like an aquarium. So this also helps to distract in a positive way the patient and not having fear and anxiety. One very practical example is you can also have a theme-based approach. So let's say we would like to improve the pediatric environment of a clinic, and you choose to set up a jungle theme, which is very popular with many children around the world. So one is, of course, you can design the scanner room very nice. But how about the waiting area even before? Can we do something for the ceiling? Because people often lie in their beds and then they have to wait until they enter the room. And we can also, and this is what I will present live, have an app where we interactively show what we can do. And we can also improve the product design, info material, and can have much more. And with that, I would like to briefly show you how we can simulate this in a live environment. And this is what we did in an app called SitePlanner Mobile. And we have here the possibility that everyone, you, me, every patient can download this app in the App Store and can actually improve his own experience. So he can use and see virtual reality environments that we already did based on real clinics. And we, for example, here put a model of the complete clinic of the University Hospital of Erlangen, which have used our models of digital twin simulations and also of new design and facility improvements to improve their waiting room. So you can see here virtually now directly how this works with different concepts. We have also something called a beach theme, what we improved in this room. So when you go here, you have also clear markings on the floor. So the idea is that you follow the right, the blue, the yellow, or the green line to see where do you have to go. Is this an MMR or a CT exam room? And here, this is what I showed you earlier. Here, this jungle themed room, but it doesn't stop here. We can simply also improve the patient experience by changing the theme to a more aquarium style room, what I showed you here. Last but not least, of course, for everyone who's more technology interested, this app also offers a very nice way of experiencing our products in an augmented reality way. So as I showed you before, you can use the models here in a 3D view, but also you can put this live on your table. And this is now my screen where I'm presenting, and you can see my living room, and I can also go and have an interactive demonstration and inspection of the system. You can see we use very high quality textures, so all the small details are there. So if you would like to explain, for example, a system to your children and to take a bit of the fear away from the child, then this is basically the way how you can do it. I hope I could give you a nice glimpse on this app. If you can please show the next slide. Exactly, then we see it's possible to download this app, and I would highly appreciate if you try it yourself, give us feedback. It's a bit of an experiment, but we found out that actually people really love it to interactively get closer to the medical technology that's behind maybe their next upcoming exam. Yeah, thank you so much. And I'm really happy if you use the chance to network, to get in touch with me if you would like to know more about this interesting topic. And thank you again, Noah, for having me in the session.
All right. Thank you, Renee. That was a really eye-opening presentation. I think the technology that you've described will be a game changer in the industry moving forward. And again, if you'd like to connect with Renee or any of his colleagues from Siemens Healthineers, you can do so by clicking on the sponsors tab in the platform to set up a meeting or have a chat with them. So thank you once again, Renee, and we hope you enjoy the rest of the conference.
Thank you so much.